Good afternoon, everyone, and thank you for joining us for the third episode of our webinar series titled The Youth Vaping Crisis, presented by Les Hagen, Executive Director of Action on Smoking and Health. I now will take this opportunity to introduce the Alberta Healthy School Community Wellness Fund, which operates out of the Centre for Healthy Communities at the School of Public Health at the University of Alberta. We have myself, Colleen Wright, and Jasmine Bonazzoni. Just a note that this webinar will be available on our website shortly following the end of the presentation. And I will now hand it over to Les.
Good afternoon, everyone. Can you hear me? Can I get a confirmation? Okay, great. Excellent. I just got a confirmation. Well, hey, it's a pleasure to be here. Many thanks to Colleen and Jasmine for inviting me to talk about youth vaping. And we do have a huge problem, and it appears to be growing. And I'm going to give you some insights into the problem and some of the solutions as we go forward. I'm going to leave at least 15 minutes at the end for questions. So please feel free to send your questions in, and I will just let Jasmine and Colleen moderate as required. And Jasmine and Colleen, please feel free to interrupt at any time, especially if things are going sideways. So let's get started here. Just for those of you who aren't aware of ASH, ASH is Western Canada's leading tobacco control organization. We've been in existence now for 40 years. Which is remarkable, considering there are national organizations, tobacco control organizations that have come and gone in that same span of time. So it's great to still be playing the game here. I haven't been around quite that long, but long enough. And over the years, ASH has provided local, provincial, national, and even global leadership on tobacco control. We haven't done this in isolation. We've had many partners and supporters, including the members of the Campaign for a Smoke-Free Alberta. But we've certainly been a part of the overall effort to help reduce tobacco use, particularly in this corner of the world. And I'm pleased to say that since I started, 30 years ago, smoking rates are almost half of what they were in the late 1980s. So tremendous progress has been made on tobacco, and it really is a shining example of public health success story. And if imagine if rates of childhood obesity today were half of what they were 30 years ago, or physical activity rates were twice of what they were 30 years ago, or homelessness and poverty were significantly reduced over that period, we would hail all of these as enormous success stories. So we have a lot to be proud of and grateful for in tobacco control and tobacco reduction, but we still have challenges, and we're talking about one of those today. So ASH is a very small organization. At any given time, I have between 2 and 10 staff, depending on projects. So it's kind of an accordion. But because we're small, we have to be very focused. And our focus has been on the development of public policy measures. So we don't run programs per se. We don't provide services for people who want to quit or prevention programs for kids. What we do, though, is we influence policies that can shape all of that, and even provincial and federal funding for those kinds of activities. We've been very engaged with all of that, creating that environment. And as an organization as well, prevention is our top priority, which means that primarily keeping kids tobacco free. So what's the big deal about tobacco? Well, it's got a huge impact on our quality of life, our economy, and our healthcare system. And in fact, it is the leading avoidable cause of premature death in Alberta and Canada and the developed world, and is expected to be the #1 preventable cause of death globally within the next 30 or 40 years as chronic disease takes over from communicable disease. So it's an enormous problem, and the economic impact in Alberta in 2014 was, just one moment. Are we having some difficulties?
I don't
Can people
believe.
hear me?
Yeah, we can hear you.
Are we having any difficulties?
Not on our end. No, it looks good.
No, okay, because someone's desperately trying to phone me, but it's not you or Jasmine, I take it.
No, it's not.
Okay, so I'm going to ignore those calls. And so huge impact on our economy. In 2014, it was 1.5 billion. Half of that was healthcare costs. The other half was lost productivity. So not only is the healthcare system bearing the brunt of tobacco use, but also employers through lost productivity resulting from tobacco-related illnesses that result in absenteeism, short and long-term disability, and premature death. And all of these things cost money for employers and certainly for the healthcare system. And of course, with tobacco, non-smokers are also affected. And tobacco has some very unique properties, no safe level of consumption. It's the only product on the market that kills 1/2 of its users when used exactly as intended. We know that nicotine is highly addictive, one of the most addictive substances on the planet. And, and unlike other harmful products, there is no safe level of consumption. Every cigarette smoked is harmful. Every cigarette smoked can easily contribute to addiction. Youth and tobacco. So this remains a huge problem, and 80% of smokers, new smokers, are addicted by the age of 18. So to this very day, the tobacco industry relies on new recruits under the age of 18 to continue to take the place of smokers who have quit or of those who have died of tobacco-related illnesses. And that's something we continue to struggle with and continue to fight to prevent the tobacco companies from targeting kids. In Alberta, this translates into 27,000 youth tobacco users in grades 7 to 12, and this was a 2017 survey. On the issue of tobacco sales to minors, Alberta has the worst compliance rate of any province. At this point, there are more rat inspectors in Alberta than tobacco inspectors because there are 0 tobacco inspectors who are devoted to keeping tobacco out of the hands of kids. Alberta also has a dubious reputation of having the most affordable cigarettes in Canada, and affordability and taxation are one of the most effective ways to reduce tobacco use, particularly among youth who have limited disposable income. So we don't have the lowest taxes, but we have the highest wages. So when you put those two together, it only takes about 30 minutes of labor for someone in Alberta to purchase a pack of cigarettes, and close to $1 in other provinces, or close to an hour of labor in other provinces. So you can see the differential there. Now, we're here today, though, to talk about vaping, and I just wanted to give you an overview and some perspective on tobacco as it relates to youth vaping. And vaping is harmful, and particularly for kids. And kids who vape are risking nicotine addiction, which is the fundamental health hazard associated with smoking, is nicotine addiction. Because without that addiction, you don't go on to a pack a day, and you don't necessarily suffer the consequences of chronic illnesses resulting from many years of smoking. So here are the numbers for vaping in Alberta. 35,500 junior, senior high school students used vaping devices in the last 30 days in Alberta in 2017. And that's up by almost a factor of 3 between 2015 and 2017. So we definitely have a crisis on our hands. There's no doubt about it, and we'll talk about the reasons why. And sadly, Alberta and Saskatchewan are the only 2 remaining provinces with no provincial laws regarding vaping or vaping devices, and that has to change. And then also we have very limited federal restrictions on vaping products. So that's a problem that needs to be solved. And as you know, kids are being targeted with alluring, high nicotine and flavored vaping devices. We call them devices like Juul and Vipe stealth devices because they're easily concealed. They're very attractive, and kids are using them in large number. Now here is the actual data between 2015 and 2017, showing the rise in vaping among kids, among youth in grades 7 to 12 here in Alberta. And you'll note that we've also seen a rise in smoking. And that's kind of alarming because that's the first meaningful rise in smoking among youth in over a decade here in Alberta. Is vaping contributing to that? Possibly. And it's a huge concern. This shows a breakdown, this slide. Oh, by the way, this data is provided by Jacob Koziel at the University of Alberta Addiction and Mental Health Lab. And his employer, Cam Wild, is an investigator on the national survey, the Canadian Student Tobacco Use Monitoring Survey that this data is all pulled from. And this is a sample taken every 2 years across Canada. I think the total sample across Canada is about 50,000 kids. And about 15,000 in Alberta. So it's pretty robust data. And you can see the lifetime prevalence, which means when you're asking kids, have you ever smoked an e-cigarette? You can see the numbers there for 2014 and 2015 versus 2016, 2017, quite a sharp jump. Also quite a sharp jump in 30-day use. That's the one we keep an eye on because that's problematic. If we know kids are using it within the last 30 days, that there is some frequency to that and perhaps some repetition. And then if we look at flavored e-cigarette use, it's almost identical. So if kids are using e-cigarettes, they're almost exclusively flavored, and that's a problem. And this is the grade breakdown, junior high versus senior high. And not surprisingly, the rates are lower in junior high, but still rising. And by the time kids hit senior high, they're well on their way to using e-cigarettes and perhaps getting addicted. So what's the big concern here? Well, vaping can easily result in nicotine addiction. Nicotine addiction can definitely lead or contribute to the development of tobacco dependence on tobacco products. So we have huge cause for concern here. We're very concerned as well about the renormalization of public smoking. The more kids see people vaping or smoking in public, the more likely they are to become smokers themselves. There are some very significant regulatory inconsistencies between tobacco and vaping products. On one hand, it's not unexpected because vaping products are newer than tobacco products. On the other hand, it's discouraging that when governments are regulating vaping products, that they're not lining the regulations up. And that is creating some problems. And vaping in and of itself has health risks. They're definitely not as significant as tobacco use or smoking. And the two most significant health risks are usually the two that are the most overlooked. And one is nicotine addiction. That's a health risk. That's an illness. Nicotine addiction is an illness. The second one is modeling. This whole concept of modeling to kids. So, we can go on to talk about, well, does vaping harm my lungs? Does vaping contribute to heart disease? And it may. The evidence is accumulating. But on those two previous points, renormalization and modeling and nicotine addiction, we know absolutely that vaping contributes to both of those. And with kids, it's monkey see, monkey do. And same with smoking. When kids see smoking, that's a cue. And the more cues children receive in their lifetime or during their childhood, the more likely they are to become smokers themselves. Modeling is an essential element of childhood development. And we know from the literature that generally speaking, when kids are exposed to unhealthy behaviors, they're more likely to adopt those unhealthy behaviors and vice versa. So, one way to reduce modeling is to ban smoking and vaping in all public places where kids gather, including parks and playgrounds and public events. And this is another reason why we need to align regulations on smoking and vaping. Here's a health risk of vaping. This Lethbridge teenager was using an e-cigarette a few years ago, and it exploded in his face, and he had severe burns. So, these aren't necessarily safe devices either, and that this is not typical, but it can happen. And knowing that this is a electronic device, it's got a battery, and it can explode is something that people should be thinking about as well. And by the way, this kid had his glasses on when that explosion happened. Otherwise, he probably would have lost his sight. Now, speaking of modeling and the renormalization of smoking, this is the kind of activity that vaping involves, and that there are clouding competitions and tricks, and kids post these things on the internet, on YouTube and Instagram and Facebook, and this is what we're dealing with: the increasing popularity of vaping devices and the use of vaping. And you can see to a rebellious youth, this might be interesting behavior, so we have to deal with it. So we've already talked about nicotine, and Juul and Vype are the two most popular youth brands on the market. And I say youth brands because kids are using them. They have very high nicotine levels. They use what we call nicotine salts, which are more readily absorbed into the bloodstream and easily in higher concentrations. Because nicotine is addictive, youth and non-smokers should not be using nicotine products. And Health Canada and other health authorities have made it very clear that kids and non-smokers should not be using any nicotine products, and that these should be used by smokers to help them quit smoking, if they are to be used at all. Having said that, we have yet to have a single vaping product in Alberta that is registered as a medical device, or that has followed the standard drug regulatory protocol, like other forms of nicotine replacement have, including the patch and the gum and inhalers. These are all approved medical devices or medical products, but not vaping devices. And it's simply because the people who market these devices just see that as an unnecessary and an expensive hurdle to just throwing this stuff on the market and promoting the heck out of it. And we have some new data now suggesting that vaping may in fact be contributing to the increase in youth smoking that we've already witnessed here in Alberta. So stay tuned. More will be coming out in the weeks and months ahead on that particular issue. So high schools across the country are struggling with vaping, and from removing washroom doors to fining and expelling students, there are a number of challenges. I presented to all of these school police officers here in Edmonton a few weeks ago, and I was told that one of the major causes of school suspensions in Edmonton right now is kids being caught with vaping products. So it's a big deal in high schools right now, sadly. And we certainly can't overlook the impact of marketing on youth, including the development of the kiddie vapes like Juul and Vype. These products should be prohibited just based on nicotine content alone, in addition to their allure and the fact that they are stealth devices and can be easily concealed. Students in schools and health groups are speaking out, and even this morning, the Canadian Council on Chief Medical Health Officers issued a strong statement calling for more action from governments and from health organizations on vaping. So there's definitely a lot of momentum building for action on this issue. Now, just getting to the regulatory inconsistencies between tobacco and vaping. Vaping promotions are allowed and broadcast in print with some restrictions, but television broadcast in print, or tobacco broadcast and print advertising is prohibited, strictly prohibited in Canada. Retail promotions and displays are allowed in 3 provinces, including Alberta, Saskatchewan, and Ontario. Tobacco retail promotions and displays have been prohibited in in every single province, with limited retail promotions allowed. And we have restrictions on public consumption. We have banned smoking in all workplaces in Alberta under the Provincial Tobacco and Smoking Reduction Act. We have not extended those restrictions to vaping products at a provincial level. Some municipalities have filled in the gap, but provincially, the provincial legislation does not speak to vaping in public places or in workplaces. And then we have no special taxes on vaping products, although we do have tobacco taxes. So I think that's another area for effective policy. So what's the federal government doing about it? Well, the federal government has been working on this problem for years, and finally introduced the Bill S5 in 2017. It was passed last May, and it amended the Tobacco Act to become the Tobacco and Vaping Act. And this act, in theory, prohibits the sales of vaping products to youth under the age of 18. It prohibits advertising that appeals to youth. It prohibits lifestyle advertising, sponsorship promotion, and the giveaways of vaping products or branded merchandise. Now, I say in theory because, in fact, we are encountering problems with the interpretation of those restrictions by the tobacco and vaping companies. Now, we warned the federal government last spring when this legislation was before Parliament and the Senate that this legislation was not strong enough, the restrictions on vaping promotions. And for instance, tobacco advertising would reappear. Unfortunately, our calls or our concerns were not taken seriously. And now we have the return of tobacco companies to television. And for the first time in almost 50 years, tobacco companies are advertising on Canadian television. And these are the Vape commercials. I'm sure you've seen them. And now they have been pulled back because they promote, because of the lifestyle provision, the ban on lifestyle advertising. But arguably, vaping ads are still allowed on television. Those that do not appeal to youth or that do not promote a lifestyle. This is very disturbing. And we have Facebook ads. And obviously, you know, kids are influenced by Facebook. The similar ads have appeared on Instagram and YouTube, and many of these ads can still be found on the internet, even though Health Canada has required some of them to be pulled. So, you know, in your mind, do these ads appeal to youth? Do these ads appeal to youth? Do these ads represent lifestyle advertising? I think they do. Because they are promoting a way of life. They are promoting a certain attractive component to using the product. Now, Physicians for Smoke-Free Canada launched a complaint to Health Canada back in November about all of these television and broadcast and internet ads. And it was a general complaint about all of the violations, and a large number of ads were submitted to Health Canada. So as of yet, that was November, we have not heard of any disciplinary action against any of these companies. Some of these ads have been pulled, but there has been no disciplinary action. No fines have been levied as far as we know. And we don't know who's received warning letters or who's received fines. None of that has been made public. So we're hoping to get that information soon. Here are the other promotions we're seeing. You're seeing these in convenience stores throughout the province, also in Saskatchewan, also in Ontario. However, Alberta, Saskatchewan, Ontario are the only provinces that allow these kinds of retail promotions. And they are omnipresent inside and outside of convenience stores. And some of these, of course, are located adjacent to schools or childcare settings. So, you know, there's another opportunity for the industry to promote its products to kids and to encourage kids to vape. Do you think these ads appeal to youth? And retail displays. Retail displays on tobacco were prohibited over 10 years ago in every single province. And now we are seeing the return of retail displays with vaping products. And as you can see, these are located at children's eye level, adjacent to the candy displays. Obviously, these appeal to kids. So what's the federal government doing about all of this? Well, the federal government has recognized that Bill S5 needs to be further better implemented and needs additional regulations. And in February, the health minister released a new notice of intent to regulate advertising targeted at youth, including point of sale advertising, public places advertising, broadcast advertising, print, and retail displays. So most of what we've already seen. Now that's a notice of intent to regulate. Now this can take years. And we've got a youth vaping problem right now that's getting worse. So AHSCWF and other health groups are calling on for the federal government to move quickly and introduce legislation because it'll actually be quicker to get legislation and amendments to the act through Parliament than it will be to go through the federal regulatory process, which again can take years, and we don't have years. Now, just this morning, the federal health minister, released a new consultation paper on regulating nicotine concentrations in vaping products. So, as I mentioned, the Juul and the Bite products have very high nicotine concentrations. Flavorings, and we've prohibited flavorings from most flavorings from tobacco products, including menthol, and then also regulating online sales. So now this is a consultation paper. This will take several months. Then the development of new proposed regulations will take several months. Then the consideration and adoption of those regulations will take several more months. So, this is going to take even longer than the previous regulatory process that's aimed at addressing advertising. So it's really, and we've got a federal election coming up in the fall, so that's going to slow everything down. So, sadly, this just isn't happening fast enough. It's the intentions are good, but the structure and the timing is bad. Now, the provincial government can step in and do all sorts of things to regulate vaping devices and consumption. But as of yet, the Alberta and Saskatchewan have not introduced any legislation to deal with vaping devices or the consumption of vaping products. And here's the latest official word we got from the Minister of Health. This goes back 2 years. Once the federal government has moved forward, then we will develop provincial regulations. Well, the federal bill, Bill S5, was passed last May. So it's almost been a year, and we haven't seen, not only have we not seen provincial regulations, we haven't even seen the beginning of a regulatory process or a consultation even on what provincial legislation and regulations on vaping would look like. Now here's a breakdown of federal and provincial vaping laws across Canada. And if you look under the columns for Alberta and Saskatchewan, you can see they're pretty bare. There are a couple of items under Alberta. It says RA, which means regulatory authority. So under our Provincial Tobacco Act, the Alberta government does have the regulatory authority to regulate the consumption of vaping and to put the same restrictions on vaping, the consumption of vaping in public places and workplaces that we currently do on smoking. However, that section of the legislation remains unproclaimed. So, and look at all these provisions that other provinces are taking. Restrictions on advertising, display bans, ban on the use of tobacco branding, restrictions on flavorings. Only one province, Quebec, has banned flavorings on vaping products. But as you can see, there's been enormous activity by provincial governments across Canada, with the very, very notable exception of Alberta and Saskatchewan. Now, now that we've talked about what the federal and provincial governments could and should be doing, there are also things that municipalities can be doing. And a number of municipalities in Alberta and across Canada have already moved in. And on the first item, which is prohibiting vaping and smoking in public places frequented by youth. So here in Alberta, we have about 8 or 10 municipalities that have aligned their smoking and vaping restrictions. And those restrictions also extend to outdoor places frequented by youth, like parks and playgrounds and public events. So we're seeing quite a bit of activity in that respect. Municipalities could also license and regulate vape shops, just like they license tobacco vendors. And we have a handful of Alberta municipalities, including Edmonton, Calgary, Lloydminster, St. Albert, and a few others that license tobacco vendors. But we could definitely license and regulate vaping shops as well. And the municipalities could be conducting regular compliance checks through their enforcement activities, and especially their local police. And they could employ underage test shoppers, just like Health Canada did for 15 years before abandoning that particular effective enforcement strategy due to federal budget cuts back in 2014. And of course, municipalities can also urge the federal and provincial governments to take action. So we're encouraging municipalities to do all of the above. And oh, by the way, yeah, 14. Here are the municipalities in Alberta that have aligned smoking and vaping restrictions and have banned smoking and vaping in many public places, outdoor public places. Okay, and I know I'm talking to the school community here today, the school wellness community. So what can schools and school boards do? Well, again, they can ensure that vaping and smoking restrictions are aligned and through their school policies and or their school board policies. They could adopt a gold standard tobacco policy, and ASH has one. It's up on our website at ash.ca, and a number of school boards have adopted our gold standard policy. School boards can provide and schools can provide effective tobacco prevention education for all grades K to 9 and make sure that there is some vaping content in there, and that's becoming available. And there are certainly more resources on vaping today than there were a year ago. And I'm going to give you some links at the end of the presentation. And of course, you can provide, schools and school boards can provide stop smoking supports, not only to staff, but also to students. Looking at your school, at your employee benefits plans, and just offering those cessation programs and reaching out to providers like Alberta Health Services to assist with providing cessation programs at the school or in the community. And then, of course, school boards can also urge the federal and provincial governments to take action, and we're encouraging them to do so. Now, here are all the smoke and vape-free school boards. And all these school boards have also received a Smoke-Free Spaces Award for making their schools smoke and vape free. So we're seeing action, and it's good. Now, what can you do? I'm sure you're asking. Well, you can start by talking to your elected officials at the federal, provincial, and local levels about the importance of this issue and the need for action at all three levels. And you can certainly encourage others to do the same. And it's never been easier for all of us to encourage others to take action on any issue. Facebook is an excellent example of reaching out to others quickly and sending them an action link or a call to action and encouraging others to make some noise with their elected officials. Hey, we've elected these people for a reason. This is a democracy. We have to exercise our democratic rights to good governance and to ensure that kids are being protected. So if you're on this call, I am expecting all 67 of you to walk away and from this presentation and take it upon yourself to visit the links at the end of this site, to engage with your elected officials, and to engage your friends and contacts to engage with their elected officials. Another important thing you can do is simply write a letter to the editor of your local paper on this very topic. And if you have a choice of writing a letter to an elected official or writing a letter to the editor, I would actually encourage the letter to the editor, because the elected official is more likely to read a letter in a newspaper than they are to go through the hundreds of emails that they're getting from their constituents on a daily or weekly or monthly basis. So don't underestimate the power of the pen here and your ability to influence public opinion and also your elected official simply by making your concerns known in your local newspaper. Of course, talking to your kids about the hazards of nicotine addiction and tobacco. Don't leave out tobacco if you're talking about nicotine, because a vaping addiction is one thing. If it leads to a tobacco addiction, you've got a much bigger problem on your hands. So there are some good resources out there as well. And please do visit protectalbertakids.ca. That's the advocacy site hosted by Campaign for a Smoke-Free Alberta. And you don't have to go beyond the first page, the home page, for a call to action on what you can do to deal with this vaping problem. Oh, and in fact, as we speak, the Campaign for Smoke-Free Alberta is distributing a statement of support on this very issue to widely throughout Alberta. It's going out to all the school trustees. Hopefully, it's going out to all the school councils soon, all the high school principals, all the health organizations, youth organizations. This is going out far and wide. This is calling on the Premier to adopt the unimplemented sections of the Tobacco and Smoking Reduction Act, and also to not overlook vaping legislation going forward. Right now, critical sections of the Tobacco Smoking and Vaping Act, or Tobacco Smoking Reduction Act, are on the chopping block because of the Repeal Act, which mandates that any legislation that is not fully proclaimed, or any sections thereof that are not fully proclaimed within 5 years of being passed in the Legislative Assembly, will be automatically repealed. And so we have 3 sections of the Act right now that are on the line. One of those would align restrictions on smoking and vaping in workplaces and public places. Another would remove all flavorings from tobacco products. And the other would prohibit all forms of smoking in workplaces, including shisha smoking. So those 3 elements are currently on the chopping block as we speak, and they will be chopped by the end of 2019, and unless Cabinet takes 5 minutes at its next meeting or an upcoming meeting to simply proclaim those sections into force. And then we've also pointed to some sections of the Act that are not being properly implemented right now. But we encourage everyone to distribute this, to sign. We're looking for organizations to sign this statement of support, and then to distribute it widely. And again, just go to protectalbertakids.ca and you'll get all the instructions you need. Now, the bottom line for this presentation is that concerted and effective efforts are required to curb youth vaping and youth tobacco use in tandem. We can't overlook tobacco use among youth in our eagerness to address vaping among youth. We still have 27,000 kids, school-aged youth, using tobacco products in Alberta in the past 30 days. That's 27,000 too many. The evidence is starting to show that increased vaping among youth may be contributing to increased smoking among youth. So we've got to deal with these issues in tandem, and we must address both if we're going to be effective. And it's a heavy topic, so just to end with some levity here, one of my favorite Gary Larson cartoon. Of course, Ash is working to preserve our species. Whoop. And just to go one back, here are the links, and I think you will. This presentation will be posted online, but we've got a special hub for school boards with all kinds of good resources for schools and school boards, including prevention programs and cessation resources. And the Alberta Quits has a separate page for teachers in schools. Health Canada has launched a new vaping page with some good resources. And please do not forget to visit protectalbertakids.ca. So that concludes the presentation, and I'll just turn it back to Jasmine to moderate.
Awesome.
Thank you.
Perfect. So there was a question here about where does vaping of cannabis fit in? Are you able to answer that?
Well, cannabis can be just as easily vaped as nicotine and cannabis oil. And, we're concerned, the fact that we're having an explosion in youth vaping at the same time cannabis is being legalized, it's almost a perfect storm. And in some cases, cannabis oil is being combined with nicotine and being used jointly. And just like we're seeing the joint use of tobacco and cannabis, the joint smoking. So it's a huge concern. And we can't overlook the impact of cannabis, especially on youth. And we should be taking steps to address all of these issues.
I will add as well that we are planning to do a cannabis topic webinar, perhaps in the fall. We have been working with Cam Wild on planning something around that. But Les, do you have any statistics or know of any statistics on youth cannabis use?
Well, prior to cannabis legalization, youth cannabis use was the lowest ever, and similarly, youth drug use in Canada prior to cannabis legalization, including tobacco, was at its lowest point ever recorded. So it's going to be very interesting to see post legalization if the rates of cannabis use among youth and the rates of tobacco use remain the same or go up. I think it's too early to tell, but it's something we need to keep an eye on. And I think at the very least, we should be redoubling our efforts to address all of these problems and to address substance abuse among youth.
Perfect, thank you. The floor is open for questions if you have questions for Les. So we'll give you a couple minutes to get those questions in. All right, I'll just continue on while we wait for those questions to come in. So thank you so much, Les, for the information you provided us today. Youth vaping has become a growing issue in our province and our country. We would like to direct you to Alberta Health Services to access resources on a variety of topics, including nutrition, active living, body image, cannabis, and tobacco reduction. The provincial teacher resource list can be found at ahs.ca/csh. We also encourage you to connect with a local AHS health promotion facilitator by emailing schoolhealthandwellness@ahs.ca. We would also like to extend our gratitude to everyone in attendance today. This webinar will be available on our website for viewing and sharing to your networks, probably tomorrow morning. Our next webinar will be on the topic of active transportation on May 30th at noon, hosted by Tracy Couts, Active School Travel Coordinator from Everactive Schools. You won't need to register, just simply access bit.ly/AHSWCF webinar the day of the session. All right, and there's another question here. Is there research on the physical health effects of vaping?
Well, there's lots of research on the physical health effects of nicotine and on the physical health effects of some of the emissions that result from vaping. And they do vary by vaping product. But some of the fact sheets that you'll find on our website and on Alberta Health's website, or Alberta Health Services website, will speak to some of those health risks. I will say this, that what comes out of a vaping device is not as harmful as smoking, but that doesn't mean it's harmless. And that's why vaping devices are to be used only by smokers who are trying to quit, and should not be used by non-smokers and certainly not by kids. And the fundamental health risk of nicotine addiction cannot be understated.
All right, so we do have a couple more minutes to ask questions. Thank you again, and if you wouldn't mind participating in a short evaluation, we greatly would appreciate it, as it will direct future topics. So you'll see the polls open at the top here. So the